WTOC AM, W224DI, W236CR, Indianapolis. It's time to discuss the important topics happening in and around Indy. It's Community Connection with Tina Cosby, brought to you by Child Advocates. Your voice, their future. On AM 1310, 92.7, 95.1 FM, The Light.
James, as I was saying, we're going to pivot here a little bit to talk about another observation being held in the month of February, and that is Oral Health Month. Were you aware of that, James?
I was not, and I'm pleasantly surprised to know that. That's important,
Yeah, I am too. There, it's a designation that's, is more than a designation, especially for our next guest. And my understanding is that they are trying to reach 300 families to give away $50,000 worth of free dental treatment. So let's bring in now Dr. Liz Simpson. Dr. Simpson is a dentist with Meridian Health Services in Anderson and Elwood, Indiana. Dr. Simpson, welcome to Community Connection. How are you today?
I'm great. How are you?
I've never been better, just hanging in there on a Wednesday. So how was the weather there?
So I'm actually in Indianapolis, and so, it's getting better, I guess I could say.
Okay. So you're in Indy, but you practice in Anderson and Elwood.
Yes, I'm
one of those. Okay. So tell us about this initiative that you're really excited about, because when I hear 300 families and free dental treatment, that's exciting, and people in that area need to know what's going on.
So, as you said, the month of February is designated as Children's Oral Health Month. And so one of the big initiatives that's put on by the American Dental Association is something called Give Kids a Smile Day. And throughout the nation, not just here in Indiana, different dental schools, different private offices, clinics, they will do a day of free treatment to highlight the disparities that we have in kids getting their dental treatment done. And so there's some offices that may be doing fillings and different kinds of treatment like that. At our clinic, we really are focusing on doing initial exams for kids. Now, I have a question for you, and you may remember because I think we talked about it already, but do you know how old children are supposed to be by the time they have their first dental visit?
I do. Thank you very much. And it was because I was chastised by my children's dentist. It's 6 months, or at the sign of their first tooth.
Yes. So that is the recommendation. And it is actually the recommendation from the American Academy of Pediatric Dentistry, the American Dental Association, the American Public Health Association, and the American Academy of Pediatrics. So this isn't just dentists that are saying this. This is people who are caring for children's overall health as well. So by the time their first tooth erupts, or definitely by the age of 1, kids should have their first dental visit. And so that's what we're really trying to promote with our Give Kids a Smile event. It sort of has the second title of Smile Baby, because we really want to target these little ones' smiles and having their families bring them in to get their first exam, cleaning, and fluoride treatment.
Yeah, so James, James Patterson is our contributing analyst, and he's joining us in our conversation now. James, meet Dr. Simpson.
Yeah.
James, were you aware of these guidelines? Because Dr. Simpson, when we were setting up the interview, we were talking, and I was letting her know that I was made to know this because I thought I was doing, with my very first one, I thought I was doing something really great because I had him in just before he was 1. And she said, "What took you so long?" And I'm like, "Huh? He's just turning 1." And she said, "No." She said, "I want to." So then by the time my daughter came along, my daughter was just around 6 months, and I took her. And so but there's a lot more to, in addition to their health. Yeah, I think it helps the way their dentist explained it as well, James, was that it helps with their losing, I guess, their fear of the dentist, if you will. Yeah, if some kids or some people have a fear of the dentist.
That. I really applaud Dr. Simpson for what she's doing in this February Oral Health Month, Give Kids a Smile Day, because I just kind of, harken back to when I was a child, and I'm several years older now, and we were, we were poor, and by the time I got to the dentist, I was like an adolescent, or at least a very older young child, because we didn't really have the money to go. And my question to her is, are you seeing children, even if they come in at 1, or if they come in at 5 years old, or they're in elementary or middle school, if you're seeing them, what kind of dental care are poor children, whatever their ethnic background or racial, what kind of dental care are you seeing, and is there a difference in some of the poor or minority children that you're seeing as regards to dental care?
So there's a couple questions in that, and I'll try to answer all of them. We see dental decay in kids from all socioeconomic backgrounds, but it is worse in children who are from a lower socioeconomic background. There are statistics that show that in African American children, around 30% have cavities on their primary teeth. So, we're talking about that first set of teeth that comes in.
Yeah.
And I've had kids that have come in at 12 months and had cavities. And
wow.
So that's part of why the recommendation to have them come in by 1 year, like at that first eruption of a tooth, up to 1 year, that was actually changed back in 2003. So we're almost looking at a recommendation that's been around for 20 years, and people don't know. And the people that need to know, they definitely don't know. And, like you said, people are bringing their kids in when they're 7 or 8, 5, 6, 7, 8 for their very first visit. And, I mean, when you have to do work on a child that young, a lot of times they have to be seen in the operating room under general anesthesia, and it becomes a whole different scenario than what it could have been if they had gotten started early.
Yeah, Dr. Simpson, thank you for answering that question. It was been a question. I didn't couch it right, separately.
Well, I think what you were talking about, James, if I may, was access.
Yeah, absolutely. And there's a lot of reasons why they come in at 7 or 8 for their first dental checkup. But I was interested in what you said. It really struck me, didn't you, Tina, that she is seeing children as young as 1 who have cavities now. Is that because of the nutritions that they're taking, or is it because they're not even, whatever dental care a baby to a 1-year-old is supposed to, take, wiping off their teeth or whatever, they're teething, they don't have them. Generally, most of them have something by 1. But is it both? Is it because of the nutrition? That's what I want to get at. Why are you seeing cavities at 1 year old?
So you brought up the issue of access, and under the umbrella of access to care, there's actually a lot of things. So when we think about access, we think about somebody getting to the dentist or somebody having insurance so they can get their dental work done. But another part of access is education. And if your parent doesn't know, about oral hygiene habits or about nutrition, then how are they going to know what they need to do for their child? So there's a combination of things that go into people of all ages getting cavities. So this is something that parents can take in also. So we all have bacteria in our mouth. Some are good and some are bad. And the ones that make you more likely to get cavities, they eat sugar in the food that we eat. And, people they'll come in with their kid will have a lot of cavities, and they'll say something like, well, they don't even really eat candy. And so I think there's this misconception that candy is the only thing that causes cavities. So if you have a child that eats a lot of what we call fermentable carbohydrates, they are probably, and they have those bacteria, they are more likely to have cavities. So if they have a steady stream of sugary things going into their mouth when they eat, those bacteria take the sugar in their food. Bacteria eat like we do, and they make waste, and their waste is what causes cavities. So if you have somebody that eats a lot of carbohydrates, and even if you think about things that kids snack on, pretzels, crackers, things that break down into sugar, they're going to have a lot of sugar going in their system, those bacteria take that sugar, they eat it, they process it, they make waste. Their waste is what causes cavities. Then if you have a child where the parent, guardian, whoever is lax about brushing, then you have bacterial waste, you have food products that it's staying on their teeth and never coming off. And so you have these kids that just have a very, very high, what we call caries rate, or, likelihood of getting cavities.
Yeah.
Wow.
Yeah, and James, the other thing that I learned, I just learned it, that the dentist pointed out, that my children's dentist pointed out, was that the earlier they go, the less, in addition to just good oral health, they have a better attitude toward going to the dentist. Because by the time my kids were 4 or 5, they were going to the back room by themselves. They had no fear because they had been going since they were, young. My son, since he was 12 months old, and my daughter, since she was 6 months old. So they used to love to go to the dentist. And you see these stories where they have to, drag the kids in, or you hear them screaming, or I'm scared, or this or that. My kids didn't pay any attention to it. And even when they were young teens, and they had to go and get their checkups and things, they would easily go two times a year with no problem. So it kind of eased that as well, James, and that made my job a whole lot easier in terms of just getting them to the dentist back and forth. And you have no idea how much easier it made, because they didn't think twice about it.
Absolutely. And I was just wondering how close Tina is, Dr. Simpson, to her goal of 300, trying to reach 300 families. And this is the middle of the month, and I'm just wondering how close she is to that goal.
Before Dr. Simpson, before you answer that, Ethan is busy. He's busy on social, and he is looking for either a Facebook link or some type of link to share on our page. Do you have any way people can find out more about it?
Yes. So our organization is Meridian hs.org. We have information on there, or they can call our clinic. So we have 4 different locations, but our free event will be Wednesday, March 10th from 8 to 5. It's an all-day event. And our clinic phone number, if they have questions, is 765-641-7684.
Okay. Because Ethan has been he's been messaging me. He's like, Ethan likes to stay social, so he's trying to get, as you're talking, he's trying to give everybody an opportunity to go to the site. So.
Yes, and here's the thing, it's not like when we get our 300th patient that day, we're going to say, well, we achieved our goal. We don't want to see any more kids. We will see as many as we can. Like I said, my goal, one of the things I'm really passionate about is educating families, especially, not just educating. I'm a general dentist, so I see patients of all ages, but I really have a passion towards teaching parents how to set their kids up to have a cavity-free life. I think people look at getting cavities as something that's just going to happen to them, and they sort of give up and throw up their hands, and cavities are entirely preventable. People do not have to have cavities. Does it take work and discipline that not a lot of us have? Yes. But I want parents to look at this like, okay, even though I had cavities, I don't want this for my kids, so what do I need to do for my child? And bringing them in, the earlier the better.
Wow. So James, I'm sorry. I was just answering Ethan's message to me. Go ahead. Did she answer your question, or did you want to finish answering?
I think she did. I just laud her for what she's doing in reaching these, because families are juggling a lot of things. We've got the pandemic, we've got employment issues, we've got food insecurity. At the top of the show, Tina was talking with Dion. He says, there are 500 plus or whatever, around 500 boxes of food going to families were almost gone. I mean, people are struggling with things. So dental service and dental care is something that families say, I'll get to it. Let me get by this mountain first. So that's great. Yeah.
And doctor, if you don't mind, we have a tweet that is coming in as you're talking, and the Brother Image up on Twitter says, Tina, you had a heart doc on recently. Could you ask the guest to expound on how important oral care is to heart health? Thanks.
Yes. So, when we have patients who come in, we take blood pressure on everybody. We do it because we're interested in our patient's overall health, and we also take it because the medicine, the anesthetic that we give, can raise your blood pressure a little bit. So if we see somebody who comes in and their blood pressure is high, we're looking at it like, all right, do you have high blood pressure that's not diagnosed? Do you maybe need to up your medication? We discuss that, and then we also discuss the implications with dentistry, which would be the anesthetic issue. And, a lot of times high blood pressure, high cholesterol, heart disease, those things can go hand in hand, especially for our Black and brown patients. And I've lost track of how many patients I have had that have come in, had high blood pressure. It hasn't been diagnosed yet. The next time they come back for their visit, they're on medication. One of the other things we see is when we have patients who have periodontal disease, which a lot of people will call sort of the catch-all of gum disease. When we look at their gum tissue, look at their x-rays, and see that hardened plaque built up under the gums, on their teeth, we know this person probably has some issues with heart disease. That same plaque that forms on your teeth, the same hardened plaque, what we call calculus, that can get stuck on your teeth is the same thing that can form in your arteries.
Oh, wow.
So very, very, very rarely will you see somebody that has extensive untreated periodontal disease and is an otherwise extremely healthy person. When you have that inflammation in your mouth, it is a sign that your body in general is inflamed. Your body is sort of like trying to heal itself from this disease state. So it's something that we see, and a lot of people, they may come to the dentist more often than they go see their physician. And so it's things that we're catching that maybe their physician hasn't caught yet because of the frequency that people see us.
Wow. So, that answers the question there, James. So how is all of this going to work? You say it's coming up March 10th. Who qualifies? Is it strictly in the Madison County area, or can anyone come? I mean, what are the parameters here so that everyone can know and be prepared?
So the main parameter is you have to be willing to wear a mask when you come in the building. We will be doing temperature checks. We will be social distancing. It will be one parent or guardian that can come back with their child. So we can't allow, if a whole family wants to come in, we just can't allow it because we're trying to keep everybody safe. There won't be appointments that day, so people can come. Like I said, it's from 8 to 5. They can come whenever they're able, and they would bring their child in. There's going to be some paperwork that they have to fill out for that particular day. They will not have to become patients of our clinic. They absolutely can if they want to. But for this event, because it is a free service event, they don't have to become a patient of our clinic. We aren't saying it's restricted to Anderson. If people want to make the drive to have their child get this exam and cleaning done, they absolutely can. We also aren't saying if a child is 6 or 7 that they can't come. While we are targeting families to come in and bring their kids for their first dental visit, we aren't going to restrict it to that. We just want to be able to come in, see these kids. We're going to do quick cleanings, like I said, fluoride treatment, and then we're going to hopefully have a couple giveaways that day. But the main thing is seeing kids and educating parents.
And so this is what's the address again, and what is the time frame for the day? What's the address?
So the address is 1547 Ohio Avenue, Anderson, Indiana, 46016. And it's Wednesday, March 10th from 8 a.m. to 5 p.m.
And no registration is necessary. It's first come, first served, it sounds like?
Right.
And you want to see, you're preferring to see children up to age 2, correct?
Yeah, like up to age 2, 1 to 3, little ones who ideally are having their first dental visit. But like I said, if parents just want to bring their kids to get checked out and get their cleaning, that is fine.
And this is on March 10th?
Yes.
From 8 a.m. until 5 p.m.?
Yes.
Wow. And you say that your target is 300 families. You want to reach 300 families, but if you have more than that, you'll just go until 5 p.m.
I mean, my coworkers may get mad at me, but
how many? By the way, how many of you are going to be doing this?
We have. Let me think. There's 2, possibly 3 dentists, 4 assistants, I think 3 hygienists. So there's a team of us. But all kids, they have to get checked by the dentist. So he and I will be working. I hope he's listening.
Okay. And James, my understanding, and Dr. Simpson, is this correct? My understanding is it's estimated it's going to be about $50,000 worth of free treatment that day?
Yes. We added it up, what it would be for an exam, a cleaning, and fluoride for 300 kids, and that's what it adds up to.
Yeah,
all free.
That's a big undertaking, and you deserve much credit for doing that. Do you expect people from Indy to drive up, or will you have a larger contingent, you think, of people coming in from Madison County?
I think we will get some people from Indy. We've done a little bit of advertising there, but obviously since we're in Anderson, the main advertising has been with some churches and community organizations there in Anderson.
Yeah, and the idea is to to basically create more access and improve access and get people in the habit, get these families in the habit of seeing a dentist with their child.
Right, and the clinic that I work at, it is considered a federally qualified health center, so we take insurance, we take Medicaid, HIP, we take some other private insurance, but we also have what's called a sliding fee scale. And so people pay based on their income and family size. Mm-hmm. So if people don't have insurance moving forward, we have a way to help them out. So it's not like if they want to become a patient, that's not going to stop them, is not having insurance.
But on the 10th, on March 10th, everything is free. There is no need for it.
Right.
Everything is free. Dr. Simpson, thank you so very much. We really appreciate it. Congratulations on this
yes.
initiative. This is great.
Thank you. I'm really excited.
Yeah, we are too. All righty. Well, we'll check in with you a little later to see how it went. Hopefully you'll have 600 kids come.
I know. That's the goal. That's the dream.
That's the dream. All righty. Thank you. Dr. Liz Simpson, dentist with Meridian Health Services in Anderson and Elwood. Thank you for joining us.
Thank you.
Indeed. And James, we're going to take a quick break right here. But before we go to break, that's really kind of neat. It's just a neat thing.
Yeah, it is. And, Tina, she brought some really important facts forward, talking about how people really don't consider taking their children to the dentist, right away. I didn't know that you should take them, by the time they're 1. And I think, you're to be commended for taking your daughter, would you say, at 6, or your son, one of your children at 6 months? That's just, and like she was saying, education is so important. People don't know. They would do it if they knew. Well, that's why this is such an important interview here, because
I'm gonna cheat a little in that I have my father, and she's passed away since then, but my father's sister was a dentist.
Oh, okay.
And I remember her telling us years and years and years ago that little kids should go to the dentist, by the time they're 1 or 2. And so that was the guidance that I was using when I took my first child, when I took my son, my oldest, when I took him to the dentist. I said, I remember she said to make sure that they get to the dentist by the time they're 1 or 2. And when I got to the dentist with him, that's when I was chastised. And she jokingly said, "What took you so long? Why are you just now coming to see me?" And I'm like, I thought I thought I had plenty of time. So, but luckily, it all worked out. But I did happen to have that family guidance. But I didn't know that even her guidelines were a little outdated. According to what Dr. Simpson was saying. So
yeah, and then what she said about cavities being totally 100% preventable. So that comes down to what we're intaking in our bodies.
Yeah. Well, and I have to say that I am well past, I'm guilty. Okay. Let me say guilty. I am past my next visit with the dentist. So I'm overdue. I need to get in there very soon as well. But, like you said, with COVID and other things getting in the way, you just kind of push certain things back.
Right. A lot going on.
Pardon?
I said there's a lot going on these days. So
yeah. So are you up to date on your dental visits?
Well, I am not, but I am going.
I'm admitting, James. Hey, guilty. I've said it. Yeah. Guilty. I am not up to date on my dental visits, but I plan to get up to date. My son asked me. He said, "When's the last time you went to the dentist, Mom?" Because I was asking him, "Have you, gone in for your cleaning?" Because he got a reminder. I said, "Oh, dang. Let me see."
I've been thinking about it. I checked into, what I need to do to sign up for my next visit there. I know where I'm going.
Yeah.
So
I do need to find a new one. That was part of it. I need to find a new dentist.
Yeah.
And a couple of people. One of my cousins has a good one, and she sent me his name. So, anyway, let's go ahead and take a break here so that Ethan can relax, because Ethan likes to relax. So, we don't have to get too far into the weeds with not taking breaks. So let's take a break right here, and then we'll come back with more Community Connection right after this, James.